Please welcome Alana Flitt.
Hi everyone, that's me. I'm Alana, and today what I want to talk to you about a little bit is what I'm calling not your daddy's chiropractic. So when we think about chiropractic, most of us think of kind of treating neck pain, back pain, headaches, sciatica, things like that, which is definitely kind of the meat and potatoes of what we do. And my colleague, Dr. Richard Zarkowski, was here yesterday. I don't know if any of you sat in with his talk yesterday, but that's definitely kind of what most people think of with chiropractic. But what I want to do today is kind of challenge those preconceived notions that maybe that's all that we can do. Because as chiropractors, and especially myself having some of the different certifications and things that I do, I really have a passion, as you just heard, for helping kind of with whole family wellness. Not just pain relief, not just treating symptoms, but really putting your entire family on a path for true health and wellness, which in my opinion is not just the absence of illness or the absence of pain, but something that you're actively striving for every day. And so that's kind of what I'm going to be touching on today, specifically with how chiropractic can be used to treat conditions during pregnancy, can be used for pediatrics, which probably is like the weirdest thing that you're going to hear all day, right? Why would a baby or a kid need to be adjusted? And I'm even going to touch a little bit on preconception and how that can be almost some of the most important things that we can do to really help set up our family for a life of health and wellness. So as Brenda mentioned, I am born and raised Western New Yorker. I grew up in Fredonia, which is where I went to school and got my bachelor's degree. I have a bachelor's degree in biology with a special emphasis on anatomy and physiology. I then went on to DeUval College, where I got my 4-year Doctor of Chiropractic degree. And after graduating from DeUval, I really found my passion within this profession. I became a member of the ICPA, which is the International Chiropractic Pediatric Association. This is an organization, it's a nationwide, actually a worldwide organization that kind of trains us and gives us a little bit of additional knowledge in really working with these sort of specialized subsets or subgroups of patients that might need a little bit different approach than traditional chiropractic. Through the ICPA, I got my certification in the Webster technique, which the Webster technique can be used on anyone who is a weight-bearing individual. So if you're up and walking on your feet, you can have a Webster adjustment. But it has specific benefit during pregnancy. I also have additional training in working with pediatric patients and some of the more gentler and kind of subtler techniques that can be used for that. And also with preconception nutrition and adjusting for, again, kind of preparing a woman's body for pregnancy and a family. So I really do have a passion for promoting not only the absence of pain or helping to get rid of your neck pain or back pain, but really promoting a lifetime and a lifestyle of family wellness. Not just for you, but for your children, your grandchildren, and your whole family. And we can do this not only through kind of traditional chiropractic, but also through nutritional consults, dietary supplements, different high-speed, low-force adjusting techniques, which is very different than what most of us think of with the crack and the pop and the snap when we think of chiropractic, as well as muscle and ligament techniques and some of my specialized training. Okay, so why did I decide to kind of specialize in this area? And I think like so many people, it was my life experiences that put me on this path. When I was in undergrad, I actually planned to go to medical school. I wanted to become an MD. That was my lifetime goal from the time that I was kind of a young child. And then my younger sister, who's 4 years younger than me, started having a lot of respiratory issues. She was sick all the time. My parents took her to numerous specialists. She went to see infectious disease specialists, specialized pediatricians, pulmonologists. No one could figure out what was wrong with her. So then, as a last-ditch effort, my parents, kind of not knowing where else to turn, took her to a chiropractor. And after 2 adjustments, it was like magic. Like half her symptoms went away. She was able to breathe better, her overall health was improving. She still has struggled with things throughout her life, but it was really a night and day difference. So that, kind of at that point, I was getting ready to apply for medical school, and I kind of hit the brakes. I was like, wait a second, let me look into this a little bit more. That's really interesting. And I sort of fell in love with the overall philosophy of letting the body heal itself. I think that our bodies are very smart, and they know what they're doing. We just have forgotten how to listen to our bodies. We've forgotten how to just remove the interference and let our bodies do what they're designed to do. So I very quickly applied for chiropractic school and started about 2 months later. Then, why did I specialize in this pregnancy and pediatric area? That's my why. That is my son, Braden. I don't know if you can tell in the picture on the slide before, but when I finished chiropractic school, I was very pregnant. We all had those nice, flattering graduation gowns on, so you might not have been able to tell, but my son was born about 4 weeks after I finished school. And I had a beautiful pregnancy. I had no morning sickness. I had no back pain. Do we have any moms in here? Can you guys say that no issues during your, I had a beautiful pregnancy. Almost no one gets as lucky as I did during their pregnancies. Most of us have something, morning sickness, back pain, leg pain, something. I had nothing. Then I went into labor, and that was an entirely different story. Oh, my labor was terrible. I was in labor for over 2 days. My labor halted at 6 centimeters. My loving and incredibly well-meaning husband had no idea what he was doing and was watching me in all of this pain, and he says to me, please do something, please do something. We were at the hospital when all of this happened, about 24 hours after my labor started. And so I was like, okay, I'm exhausted, we can kickstart this a little bit. So I had a Pitocin drip. Did anyone ever have Pitocin? Worst thing in the world. If you think your contractions are bad on their own, add Pitocin on top of it, oh my gosh, those contractions are terrible. So now I'm having these ridiculously strong contractions that are still not doing anything. I'm still halted in my labor. Now I'm having back labor too, which is far worse than regular labor. And I am quite literally doubling over in pain. And again, my husband, I'm married to a wonderful man, but he is just clueless when it comes to this stuff. So he's looking at me, he's watching me. And my whole pregnancy, I had been determined to have an intervention-free delivery. That was my plan. So he's watching me doubled over in pain. And he's like, please get the epidural. Please get the epidural. I can't watch you like this anymore. So again, I'm probably now 30 hours into this, haven't slept at all, can't eat anything, right? So my willpower is shrinking and shrinking as this is going on. So I get the epidural. And after you have an epidural, you can only be on your back because it essentially paralyzes you from the waist down, right? You can't feel anything, you can't move. Which now, on the back side of this, I have since learned that on your back is one of the worst ways to have a baby, just biomechanically, because you're kind of crunching your sacrum in and you're limiting the space that the baby has to come out. So it just makes it harder. So I have an epidural, I'm stuck in the bed. I finally get to 10 centimeters. Now it's been, 36 hours, something like that. Do we have any hockey fans in here? Okay, so this was 2013, it was during the playoffs. I don't know if you remember, there was a playoff game with Boston, and I can't remember who they were playing, but it went into like 6 overtimes. That was when I was in labor, and the running joke was which of these is going to close, which of these is going to end first, right? The game ended long before my son was actually born, long before. So I finally get to 10 centimeters, and I start pushing. Great. The nurse comes in, she's like, this baby seems really close, like I don't think this is going to take very long at all. Awesome. I am fully trusting in what you're telling me right now. 4 hours later, there is still no baby. 4 hours of pushing after 36 hours of no sleep, no food. Man, I was tired. So the doctor comes in at this point and says to me, this baby is not coming out right now. I'm like, really? I couldn't tell, right? So she says, we have two options at this point. We can either go in with forceps, or you can have a C-section. And I was spent. I had nothing left in the tank. I was so physically and mentally and emotionally exhausted that I was like, you know what? I'm doing a C-section. I can't do this anymore. So my son was born via C-section, which I am so grateful for C-sections, because at that point, one or both of us probably would have died if they had not been invented yet. However, that was not what I envisioned for myself. That was not what I thought would happen. I fell into what I now consider the cascade of intervention. That's what I kind of call it now. Where one thing led to another, led to another, led to another, that ended with my son being born by a C-section. And then, after that, oh, there's my little family, right before we were leaving the hospital. But then, after that, before that second picture, that's what happened. My beautiful baby boy had to go into the NICU. So he was in the neonatal intensive care unit, thank God not for very long. But when he was born, he developed a condition called wet lung, which wet lung is a relatively common condition in larger C-section babies, which I definitely had a larger C-section baby. He was 22.5 inches long and weighed 9 pounds, 8 ounces. So for the first 3 days of my life, or his life, my beautiful little boy was in the neonatal intensive care unit with a feeding tube, hooked up to all kinds of wires and monitors, because during the normal birthing process, the fluid that's in the baby's lungs is squeezed out, and that didn't happen with him. All that fluid was still in his lungs. So he was breathing too quickly, which gives the doctors a fear that the baby could aspirate when they're eating and cause pneumonia and things like that. So I was not able to hold my baby, I was not able to feed my baby, I was not able to hug my baby for the first 3 days of his life. And I felt like my body had failed me, I felt like I had failed my son, and I took that experience and I was like, okay, I can either deal with these really negative emotions, or I can turn this into something better. I can help other women get the birth experiences that they want. And so that's what really gave me this passion. And again, there is nothing wrong with C-sections, and some moms want to have C-sections, and that is totally okay. That I am not in any way saying that there's anything wrong with that. But I have become very passionate about trying to empower women to have the experience that they want, because I believe that we are powerful and our bodies are amazing. And if we just remove that interference and we let our bodies do what they know how to do, then we can get the experiences that we want. So that's what kind of led me on this path. After that was when I joined the ICPA and started to get some of that additional training in helping with pregnant women and pediatric patients and things like that. Whew, got a little emotional there, sorry guys. Okay, so now I want to talk about some of the changes that our bodies undergo during pregnancy. According to the American Pediatric Association, 50 to 70% of women will experience low back pain during their pregnancies. And I know I said that this is kind of about using chiropractic in other ways, but I think that during pregnancy there's definitely an aspect of pain. So why does this happen? Well, we've all seen pregnant women, right? Like towards the end of your pregnancy, your belly sticks out, you get this big curve in your low back, we kind of get that pregnant lady waddle where we can't walk normally anymore, right? And all of that happens for a few different reasons physiologically that are going on in our bodies. So first of all, we're having changing hormones, specifically this hormone called relaxin. The purpose of relaxin is to relax the ligaments. The reason that we need that is so that the pelvis can open up so the baby can be born. However, the way that hormones work, they do not only target the area that they're designed to target. They float through our entire bodies. So that relaxin is coursing through your whole body. So every ligament in your body is being loosened. So those ligaments, part of their purpose is to hold your joints in place. So your joints can't hold in place quite as well as they can when you're not pregnant. We also have a changing center of gravity when we're pregnant. Again, normally we have this nice, straight kind of plumb line dropping our body weight right down to the ground. But when we're pregnant, that changes so much, right? Again, our hips kind of pop back, our back arches up, and our center of gravity changes. There's a lot of additional weight. Most people will not gain more weight in a shorter period of time than when they're pregnant. Not only in your belly, but your bust line can grow, things like that, and that changes our posture. So what can chiropractic do to help with these kind of musculoskeletal low back complaints during pregnancy? By adjusting the pelvis and the low back, we can get rid of some of that pain. We can release the tightness and the tension in some of the muscles and ligaments causing some of that pain. When anyone was pregnant, did you ever get that pain in the front, kind of when you would roll over in bed? You might feel a sharp pain in the front. That's round ligament pain, which is the ligament that supports your uterus. And it stretches a little bit. It's actually the only ligament in the body that has muscle fibers in it as well. So it stretches, but it's really painful when it does. So we can get rid of some of that too. We can give you postural correction exercises and things like that to help minimize that effect of the changing center of gravity. And also use nutritional and dietary things just to help give your body the proper nutrients. This is one of the diagrams that I really like, kind of showing a lot of that. Again, your head goes forward, your neck tips back, so not only low back pain, but neck pain, tingling into your arms and hands, headaches. All of this can develop during pregnancy because of the way that your body is changing. So, how else can you use chiropractic during pregnancy? Again, it is not just about getting rid of the pain. Having a well-adjusted mother can actually help the physiology of both the mother and the baby. That might seem kind of weird. How are we changing the physiology in the baby? By not doing anything to the baby. But chiropractic works with your body's natural ability to adapt and function properly. And by adjusting the mother and removing any nervous system interference in the mother, we can help that physiology in the baby as well. Your nervous system controls everything. By reducing that interference, by getting the mother's pelvis into a nice alignment, we can see better fetal positioning and sometimes an easier birth. So, I've had this question before, do you turn breech babies? No, I do not turn breech babies. I am not an OBGYN. That is not what I do. However, frequently, a breech presentation, which is when your baby is head up instead of head down, can be a normal response of the baby to a misaligned pelvis in the mother. So, if that is the reason for the breech presentation, and we remove that misalignment, we get rid of the torsion and tension on the ligaments, we get the mother's pelvis back to a normal alignment, up to 80 to 90% of babies will then flip on their own. And really quick side note, I had a patient who was, I think, 34 weeks pregnant when she first started coming to see me. First time she was in, her baby was breech. That was why she was there. I had that conversation with her. I don't turn breech babies, but if it's because of your pelvis, maybe the baby will turn on their own. I do my analysis. I get her adjusted, nice light adjustment. She goes to stand up off the table and we both see this big old roll in her belly. And I said to her, I can't tell you that your baby just flipped, but you should go check with your midwife right now. She came back and sure enough, that was exactly what happened. It was the coolest thing I've ever seen. Before she left the treatment room, her baby did a little somersault and was ready to be born. She then went on to have a beautiful home birth, which is what she wanted. So again, we don't turn breech babies, but if the problem is the alignment of the mother's pelvis, by getting rid of that problem, by getting rid of that interference, the baby can do, your body can do what they know how to do if we just get rid of that interference. So, who can benefit? What pregnant women can benefit from chiropractic? My answer is everyone. You don't have to wait until you're having pain. You don't have to wait until there is an issue. Chiropractic during pregnancy is very complementary to your regular OBGYN or midwife care. I actually have a couple practitioners in the area who refer me a lot of patients when they're having issues. And Dr. Catherine Faulkner, who works with OBGYN Associates of Western New York, had this to say: comprehensive care can enhance pregnancy and birth experience. The use of chiropractic in pregnancy can be a wonderful adjunct for women who may be suffering from sciatic pain, low back pain, or pelvic pain, all of which most women will suffer from at some point in their pregnancy. I also feel that good alignment assists in the pelvis being able to open and accommodate the baby emerging and facilitating a delivery. And then Maura Winkler, who is kind of new to our area, but owns Fika Midwifery and is a certified nursing midwife, said, I have seen the benefits of Webster both in alleviating discomfort during pregnancy and in labor, as well as helping to prevent breech or posterior babies, which posterior means they're facing kind of face up instead of face down when they come out. In particular, for the first time woman or mother or a woman planning a vaginal birth after cesarean, chiropractic care can be the difference between a vaginal birth and a cesarean birth. So again, my opinion is everyone who's pregnant can benefit in some way from chiropractic care. Okay, so switching gears a little bit, I want to talk about some of the pediatric chiropractic. Again, this probably seems like a very foreign topic, right? Like, why in the world would any baby need to be adjusted? Why would any child need to be adjusted? Is it safe? Yes.
I brought it 3 weeks of my 3-week-old daughter to her.
Beautiful.
She was so constipated.
Mm-hmm.
Wasn't cracking her.
Yep.
Simply was beside her.
Yep.
This is like 27 years ago.
You were a woman ahead of your time, I think.
3-week-old.
Yep.
No.
Yep, absolutely. So that's my first point up here. There is no cracking or popping that is necessary, especially with babies. I have never cracked a baby. I never plan to crack a baby. That's not what you need to do. And again, you're not really treating any pain. That's not what I'm trying to do either. Babies can't communicate pain. We have no way of knowing if they're feeling pain. But what it does is it helps to remove that nervous system interference. And again, if the nervous system isn't functioning properly, nothing else can function properly. So it can help to relieve an array of musculoskeletal conditions, which can develop even in infancy. And I'll touch on a few of those in just a minute. But the real goal is to optimize that baby or that child's health and wellness overall. It's not about treating a condition. It's about giving that baby or that child the best chance to kind of move forward and live their healthiest life starting at the very beginning. And again, the nervous system controls the rest of the baby's system, so we're enhancing the body's natural abilities. So, first question, is it safe? Yes, it is safe. It's as safe as any sort of medication that your child might need, your baby might need, and in my opinion, it's even safer. There is no cracking or popping. I can't stress that point enough because I think that that's the biggest thing that people get hooked up on. Yeah.
So it is safe for a child who has MS or TSC?
Sure. It could actually help with that a little bit too. Again, MS is a nervous system disorder. So by getting the child's nervous system to function the best that it can, you may even see a reduction in some of the symptoms. So with babies and really young children in particular, the way I like to describe the amount of pressure that I'm using is it's the amount of pressure that you would use to squeeze a tomato to see how ripe it is or kind of rub something off of your eyelid. That's as much pressure as is needed to adjust a baby. A baby doesn't have hard, solid bones the way that we do. They're still very soft. They haven't fully what we call ossified yet, which means they haven't hardened all the way yet. So you don't need to do any sort of really hard manipulation. It just takes that little bit of pressure and maybe a little wiggle to get those joints to kind of realign again. And it is completely non-invasive and gentle, which is more than you can say for a lot of medications. I have a patient right now who's bringing her daughter in to see me, who is, she has acid reflux, and she is on a daily Prilosec medication, which to me is the weirdest thing. How is this baby's system supposed to learn how to function if from the time they're an infant, they're on a medication that's designed to change their system function. That doesn't make any sense, at least not to me. If we can just get that child's body working normally, then they can learn how to work normally for the rest of that child's entire life. I personally think that putting a child, and medications are necessary, for sure, but we have a very over-medicated population. In our society, medication is our first line of defense. I don't think it should be our first line. But in my opinion, putting that child on a digestive medication from infancy could create a ton of problems down the line, you know? You're not letting that baby's digestive system develop. So how is that child going to grow into an adult that can digest food? Weird to think about. But to me, it just makes a lot more sense. And the reason for that is we are not trying to alter the body's function, which is what most medications are designed to do. They alter the physiology of our body. But instead, we are trying to enhance the body's natural ability and enhance the body's natural function. Okay, so what are some musculoskeletal conditions that can be helped from chiropractic for children? Because again, as chiropractors, we only treat musculoskeletal conditions. I don't treat anything other than musculoskeletal conditions. Babies can have nursing trouble or trouble latching. Sometimes a baby will have a misalignment in their neck that makes it so that they can't turn their head both ways, which can lead to a painful latch for the mother or difficulty nursing. I had a patient who brought in her little boy to me. He was born premature and was in the NICU for quite a while actually. And very shortly after he came out, the mother, who was a patient of mine, said he will only nurse on the left side. What can I do? She said, I'm pumping from the other side and giving him bottles, but I don't want to have to do that. And I said, bring him in. Let's see what's going on. So I did a very gentle, specific adjustment in his neck. And the next day, he was nursing on both sides, no problems. Babies can be born or shortly after birth develop a condition called torticollis, which is that first picture that you see over there. Torticollis is when some of the muscles in the neck, for some reason, get really tight, and it kind of pulls on that side of the head, shifts your head to one side, and turns your chin up the other way. So what that baby has is a right-sided torticollis because their head is tipped to the right. By releasing that muscle spasm, by realigning the vertebrae in the neck and the upper back, we can help to relieve some of that torticollis. You can also see asymmetrical movements or asymmetrical crawling when the baby starts to crawl. Sometimes that can be because of misalignments in the low back or the sacrum. We use a lot of tools to kind of teach our babies how to sit and move and bounce and things like that, but sometimes they're not really designed perfectly for a child's anatomy. So that can lead to some misalignments in the lower half of the body as well. And we can also help potentially with delayed physical milestones like standing and walking and things like that. Again, if the reason is that their spine's not properly aligned. So what do we see in older children? Sports injuries, that looks like fun, right? A little baseball, sliding into home base there. That looks like it hurt, actually. Bumps and bruises, concussions, headaches, postural issues. Our kids are forced to have heavy backpacks at a very young age, and most of us don't know how to wear them, which can lead to postural issues. They're either kind of leaning backwards to support that bag, or they're leaning forward to put that weight on top of their back. All of those things can lead to misalignments and musculoskeletal issues that chiropractic can help with in children. Okay, but what else can it do? So again, can chiropractic help with non-musculoskeletal conditions? Really? Really? Not directly. I don't treat bedwetting. I don't treat ear infections. I don't treat asthma. That's not what I do. I'm not a pediatrician. I don't treat that stuff. But going back to that theme that our nervous system controls all of the other functions in our body, if we can find and remove the stress on the nervous system in that child, we can improve the nervous system function, which can in turn enhance all of the other system functions. So that mother that I was talking about before, I've seen her daughter 3 times, and she has seen a marked reduction in her daughter's reflux that hadn't really been improving a whole lot with the Prilosec. And she's now ready to talk with her pediatrician about weaning the baby off of the medication. Did I treat acid reflux? No. I just got rid of any of the interference in that baby's nervous system that let the baby's body learn how to function properly. So anecdotally, these are some of the things that you might see improvement with. Anecdotally, I've seen my own patients have success in some of these. My own son. Another quick story about my son. We have a big old 90-pound dog. His name is Zeus, and he is the most lovable dog you will ever meet, but he is a beast. And at the beginning of this school year, my son just is finishing up kindergarten. At the beginning of this school year, I thought I would be really overzealous, and I'm like, yeah, I can walk Brayden to school and Zeus. And I open the garage door, and Zeus sees another dog, and he takes off before we're even out of the garage. In the process, he knocks my son over. My son falls into the snowblower that was stored in the corner of our garage, smacked his chin, and his head got whipped backwards a little bit. He's bleeding all over, so obviously my first concern is, okay, let's get him cleaned up. Poor kid got so upset that he threw up all over my floor, so then that was my next concern, let's clean that up. And then once we all got settled down, about an hour or so later, we get him off to school. For the next 2 nights, he was wetting the bed. My son had been potty trained for 2 years, and he was wetting the bed. I was like, why the heck didn't I adjust him? I'm a chiropractor. Why didn't I think to adjust him? So I adjust him. Again, just some very gentle adjustments, mostly in his neck because of that kind of whiplash motion that he had. He's been dry ever since. Those 2 nights were the only 2 nights he wet the bed. Is it a coincidence? Maybe. Do I think it is? No. That motion of getting his head knocked back jarred his neck, created an interruption between his brain and his bladder and his bladder and his brain, so he wasn't waking up when his body was telling him he had to go to the bathroom. We got rid of that interference. He hasn't had a wet night again since. I don't think that's a coincidence. But again, did I treat bedwetting? Is that what I was treating? No. Okay, so again, why do you start chiropractic young? What are the potential benefits of bringing a child to the chiropractor? Developing healthy habits starting at the very beginning. Get them started on the path for good posture throughout their entire life. Smartphones are terrible. Woo! They're gonna keep us in business for a long time, especially now that kids are getting their hands on them, right? From the very beginning, even my own son, I see him like this. Buddy, come on, get your head up. Don't look down all the time. Again, we're removing that nervous system interference, and it's not about treating a symptom, but about actively working towards wellness. And if you can start your child on a path to wellness at the beginning, that is the path that they can continue throughout their entire life. It's a lot better to start easy, better habits than to try to change bad habits. So we want to start those good habits early. Okay, so the last topic that I want to talk to you about, and this will kind of be the briefest topic as well, is actually preconception care. So we've talked about mothers, we've talked about babies, but why is it important to have a healthy preconception time? I believe that pregnancy is a side effect of good health. If you are healthy, if you are functioning properly, you should be able to show a healthy level of fertility as well. So how do we obtain good health? That is not something that we just have. We have to work for it. We have to reach for it. What is epigenetics? Epigenetics is a new kind of branch of science that's been recently coming out, and I'm going to touch on that a little bit in just a couple slides. But why is preconception health so important? When you are first pregnant, sometimes before you even know you're pregnant, the first 8 weeks or so of pregnancy, the only nutrition, the only nutrients that that baby can get is from the mother's uterine lining, which was there before she became pregnant. So if you're not giving your body proper nutrients, proper nutrition in that preconception time, that baby's not going to be having the highest quality nutrients once they're conceived. This is especially important if you're pregnant with a girl. Does anyone have any idea why? Why it might be? I mean, it's important for boys too, but it's especially important if you're pregnant with a girl. Any ideas?
Maybe some
Close. You're like right on it. So a female is born with every egg that she is going to have. So when you are pregnant with a girl, you are not only worried about your own health, you are not only worried about your daughter's health, but you are worried about your grandchild's health. Because every egg that that baby girl will have is developed and formed by the time she is born. So we were all in our maternal grandmother in the form of our mother, which is kind of cool. I never got to meet my maternal grandmother. She died before I was born. So that's kind of a really cool connection that I feel like I have with her, even without being able to meet her. But yeah, a girl is born with every single egg that she would have. Men produce sperm throughout their entire life. So that's your own nutrition. That's on you. But your mother and your grandmother's nutrition had a part to play in how healthy you are today. And for mothers, your nutrition has a part to play in how healthy your grandchildren will be. So, a little bit about infertility. Infertility is far more common than we might think that it is. 1 in 8 couples in the United States, 1 in 8 women suffers from infertility. That's about 12%. So in this room, there's probably about 16 women, so it's quite possible that 2 of you may have had fertility issues. Sometimes the cause is known. When the cause is known, usually about half the time it's the woman, half the time it's the man. But in 15% of cases, that is unknown. And traditional care for infertility consists of medications, IUI, which is intrauterine insemination, and IVF, and a few other things. And I just want to touch on the medications for a moment. So again, I think that it is our own life experiences that shape the path that we're on. So my husband and I, for 4 years, have been trying to have another baby. When my son was about 2, we decided that we were ready for another one, and after 0, and I mean 0 issues the first time, he pretty much sneezed on me and I was pregnant, we have been trying for 4 years. So I started down that path of traditional fertility care. And I went as far as some medications and injections. And the purpose of most fertility medications is to increase the number of eggs that the woman is producing, which, if the woman is now producing good fertile eggs, can help. But if the problem is the man, or if the problem is the sperm can't get there, having more eggs isn't going to do anything. So I was injecting myself with this medication, and I was taking some pills. I was on Clomid and Femora on different cycles. And then I saw this commercial. And the commercial was for breast cancer, a new chemotherapy drug that was coming out for breast cancer. And it listed the medication that I was on. And I was like, what? So I started researching a little bit, and usually I'm the person who researches right away. But I so desperately wanted another baby at this point that I was like, you're my doctor, I trust you, let's do this. And I found out that the medication that I was taking is a chemotherapy drug that is designed to treat postmenopausal breast cancer. Postmenopausal. So every medication that comes out has a pregnancy category rating. And basically what that rating is how safe is that medication for a woman to be taking if they are pregnant or could become pregnant. And this specific medication is pregnancy category X, which just sounds bad, right? I mean, X just sounds bad, and it is. It's the worst one out there. The CDC actually says that if the medication is pregnancy category X, the risk of using this drug clearly outweighs any positive benefit during pregnancy. Again, this is just during pregnancy. So I'm on this pregnancy category X medication that is supposed to be helping me get pregnant? What? Again, I was like, what the heck? This doesn't make any sense. This doesn't make any sense. So on doing a little bit more research, I found out that the entire country of Canada has come out and publicly warned against using this medication for an off-label use of fertility. We're a little bit behind the times in the US, if you ask me. So at that point I was like, yeah, I'm done with this. I want another baby, but I am not willing to sacrifice my own health to make that happen. So I started down this kind of path of looking at epigenetics and things like that. In my opinion, there is no fertility medication that is a good option. Some are better than others, but there's nothing that's a good option. Okay, so what is epigenetics? What is this kind of emerging study? So in the early 2000s, we came out with the Human Genome Project. And when that was completed, scientists discovered that there are not nearly enough genes in the human genome to cover the wide range of diseases and illnesses that we have. So they were expecting to find far more genes than we have. So what does that mean? There was something that was missing, and that's where epigenetics comes in. So epigenetics is the study of how the environment has an effect on our DNA and on our genetics. So think of identical twins. Identical twins have the exact same DNA, right? They're identical twins. One of them develops cancer and the other doesn't. Why does that happen? If it's just based on genetics, they should either both have cancer or they should never have cancer, right? So it's the effect that the environment has on how their genetics is being expressed. So our environment can actually turn certain genes on or turn certain genes off. A good example is in our area in Western New York, we have a really high incidence of thyroid dysfunction, hyperthyroidism, thyroid cancer. Why? There's something in our environment here that makes us more prone in this area to having thyroid issues. So why is this so important? Every single cell in your body is constantly being overturned. So it takes 3 to 4 months for every cell to be a new cell. What do I mean by that? In 3 or 4 months, the person sitting in that chair will be a completely different person, cell for cell, than the one sitting there right now. So 3 months' time, not a single cell in your body will be the same as it is right now. So what does that mean? That means that every day, the nutrition, the environmental factors that we have on our body is having an impact on who our body is going to be in 3 or 4 months. Every day we are making active decisions, whether we realize it or not, towards better health or towards worse health. Every single day. We should actively be working towards that wellness and that health. We need to be making decisions now that will impact our health down the line. And that's where epigenetics comes into play with fertility. If we make proper decisions now, if we make decisions that help to improve and enhance our own body system and our own health and wellness, then we can see that healthy side effect of proper health in increased fertility. So, how can chiropractic help with this? Again, chiropractic is designed to enhance your normal body function. Yes, we treat back pain. Yes, we treat neck pain, but we can do so much more than that. We don't treat. We enhance your normal body function by removing that interference. We can help to promote that true health and wellness, not just treating illnesses, which again, in my opinion, health is not the absence of disease. It is something that you are striving for. It's not an end result, it's a process every single day. So I have kind of adopted what we call the 8 essentials for fertility in particular, but really for anyone who may be looking to just kind of improve their health overall. The 8 essentials are vitamin D3, especially again, in our area, we get vitamin D through the sun, so we do not get enough sun. Almost all of us have a vitamin D deficiency. Omega-3s, so fatty acids that help to increase our overall health of our cardiovascular system and things like that. Glyconutrients, which help our body communicate on a cellular level. So one cell in our body can communicate with the next. Proper hydration. Does anyone know how much water we should be drinking on a day? Average? Ballpark? 80 ounces?
8 ounces. 8 adults with 8 ounces.
So for some people, that's correct. So the CDC actually recommends that you consume half of your body weight in ounces a day, minimum. So if you weigh 200 pounds, you should be drinking 100 fluid ounces of water a day. If you weigh 150 pounds, you should be drinking 75 ounces of water a day. For most of us, that probably seems like a lot, because almost all of us are dehydrated on a daily basis, myself included. I am a coffee drinker only in the morning. However, I have now started making myself drink a 25-ounce bottle of water before I will let myself have my coffee. My coffee is my reward for my water. Enough sleep. Almost none of us get enough sleep. We should be striving for 8 hours a night. To really have a healthy lifestyle, we should be striving for 8 hours a night. Let me tell you, I fall short of that almost every day. Exercise, in my opinion, adding chiropractic in to, again, remove any interference and having a positive mindset. I think that we don't put enough emphasis on what having a positive mindset can have physically on our body. It can have such a huge effect on our body. We see people who are suffering from the same kinds of cancers. One of them has a positive outlook. They say, yeah, I'm gonna beat this. They have a much higher likelihood of actually beating it than someone who has already decided that they're gonna die from it. So having a positive mindset can have a huge effect. Yes?
I just want to say, you can absolutely drink too much water.
You can drink too much water.
A number of years ago, I wanted to lose weight.
Mm-hmm.
So I was always a water drinker. So like I helped with my intake.
Mm-hmm.
And I got very shaky. And when I went to the doctor, he goes, "You're throwing your electrolytes out.
And yes,
You're drinking too much."
yes, and that is possible. Yep. I think that most of us are on the other end of it though, where we're not drinking enough, but it absolutely is possible to drink too much, especially if you're on certain medications. Yeah, so again, as far as fertility is concerned, and the preconception phase is concerned, in my opinion, it's not about having a baby. It's about having a healthy baby, because a healthy baby turns into a healthy child, turns into a healthy adult. And what does any parent want more than a healthy child, right? Thomas Edison in 1903 said, "The doctors of the future will give no medicine, but will instruct his patients in care of the human frame, in diet, and in the cause and prevention of disease." I think, unfortunately, we're still moving in the opposite direction. But I think that more and more people are starting to come around and see that we can do a lot more to prevent disease than we are, which can lead to the need for less intervention. That was 1903. So kind of to wrap things up, not your daddy's chiropractic. Daddy goes to the chiropractor for back pain, for neck pain. So does mommy sometimes. But we can do so much more than that. It's about promoting true health and wellness throughout your entire life. All stages of life, from preconception to pregnancy, to infancy and childhood, to adulthood. If you can start on the right path now, you're gonna stay on that path. Yes?
How does the work that you do on a child differ from, say, something like massage therapy?
So massage therapy is mostly concerned with the muscular health. With chiropractic, we are trained to find misalignments in the actual vertebral column as well. So we're dealing with the bones too, which can have a more direct input on the nervous system. I love massage. I think massage is excellent, but it is a little bit different. They're mostly dealing with muscular health, where we're going a little bit deeper to some of those deeper levels.
So you'll find, I think you had mentioned you do pressure points on the bones of a child.
Yes. So my niece is 1, and my sister, I love my sister, her daughter's been suffering from ear infections. And she waits until she has an ear infection, and then she's like, "Hey, can you adjust her?" And I'm like, "Sure, I'd love to, but let's like, we live 2 blocks away, like let's see each other regularly and maybe we can." Anyways, she thinks her daughter has another ear infection, and actually just last night I was coaching my son's soccer team, and I was like, "You know what, Maria, bring her over to the field and I'll adjust her afterwards." And what I was feeling in her was just a little bit of a misalignment on the very top vertebrae in her neck. And I said to my sister, "You know what, when Mary's sleeping, does she turn her head one way or the other?" And she said, "You know what, yeah, now that you mention it, every time she falls asleep, especially in a car seat, her head's down like this." So I think that might be the problem, because when your head's down like this, that's kind of shifting backwards in the top of your neck. So where massage therapy would just be working on those muscles, I can actually, or chiropractors, can find those misalignments too and very gently correct them.